scientists reviewed several studies and found that prolonged cell phone use may increase the risk of two types of tumors, one of them cancerous. In fact, cell phone manufacturers also advise that cell phones be kept 5/8 of an inch away from the body. Experts say the smarter the phone, the more the radiation. It also says that cell phone users should try to reduce exposure to energy emitted from the study conducted by a panel of 31 international scientists. This one is Shalini and Philip Mani of the report.
The use of cell phones may cause cancer. That's the new warning coming from the World Health Organization. A team of 31 scientists reviewed several studies on cell phone usage and found that prolonged use may increase the risk for two types of tumors. The doctor who headed the research team said in a statement released by the WHO, the conclusion means that there could be some risk and therefore we need to keep a close watch for a link between cell phones and cancer risk. The experts cited a study up to the year 2004 that found a 40% increased risk for a type of tumor called glioma in heavy users on average speaking on their mobiles for 30 minutes a day for 10 years. But cell phone habits have changed drastically since then. Many of us use our phones way more than that. In fact, India is one of the fastest growing markets and is expected to hit 1 million users by 2050. The European Environmental Agency is pushing for more studies, saying cell phones could be as big a public health risk as asbestos and smoking. That's not likely to surprise American real estate agent Alan Marks, who's been fighting for warnings to be put directly on cell phones. He's convinced his mobile phone use resulted in a malignant brain tumor the size of a golf ball.
I know what it is. It gives my cell phone use. There's no way to put something to your head for 20 years and not have it cause something.
Earlier studies have found that cell phone use changes the way your brain functions and even interferes with your sleep patterns. Doctors have also been warning about the danger when it comes to children.
This is the skull bone and this is the area which is in contact with the cell phone directly. So in younger people, it has been seen that the thickness of the skull bone is much thinner as compared to grown-up people. So the bad effects of these rays will be much more in younger people.
Even as the cell phone industry maintains there is no conclusive proof of danger, their own user manuals advise that you keep your phones some 5/8 of an inch away from your body, not pressed to your ear, not even in your pockets. With Hridik Mandal in New Delhi, Shalini.
Right, so should you be worried about your cell phone? Joining us this evening, Dr. Sameer Kaur, oncologist from the Apollo Hospitals. He's here with us in our studios here in Noida. And also joining us is Dr. Girish, professor from IIT Mumbai, who's going to demonstrate to us how radiation actually works and could affect you. But first, you, Dr. Sameer Kaur, should we be worried at all?
I think we should be careful and cautious. Like the study said, we don't have to be alarmist, but yes, more studies are required and more information is required. But I would warn against being alarmist. We have to be careful. We have to tread the middle path. Because it's not out there, everything is not out there in the open. 10 years down the line, you could draw conclusions that you haven't drawn together. That's what happens in science.
Certainly, a definitive study will take a long while, but many would argue that by then so many more would be affected, especially children. They're now starting to pick up cell phones at the age of 10. Wouldn't you say that erring on the side of caution would include perhaps accepting that now at this study from the WHO is saying that there is an elevated risk between certain types of cancer and cell phones? It should be taken more than seriously.
Well, no matter, I support your caution, I support your reason as an activist or as a human being, as a community, as various groups to be worried about health and things that are carcinogenic and cause cancers. But at the same time, I would caution against jumping to conclusions. There's been a plethora of reports so far. And the largest trial reported in the International Journal of Epidemiology by the same international agency for cancer control, which is based in Lyon, in France, said in an interglobe trial of 13 countries, of which most of the European countries were a part, they pooled meta-analysis and at that point of time said that there was no direct link between brain tumors, gliomas, the benign tumors, the acoustic neuromas, and the meningiomas.
Alright.
So there's research and research.
Research and research, except that this is the latest research from the IARC and something that even cell phone companies are looking at.
Can I tell you that out of these 13 countries that reported, there were 2 countries, which was Denmark and Sweden, which said individually reported a higher incidence of these tumors. But when the entire data was analyzed, there was no statistical significance.
Let's just go across to Dr. Girish Nayak from IIT Provide. So would you agree with the sense that Dr. Kaul is giving us that there is no real reason to be alarmist about this?
No, I think there are all the reasons to be alarmist about it. I have been telling for the last 2 years that there are a lot of health problems associated with the mobile phone. In fact, I had given one presentation at KEM hospital last year, and after my presentation many doctors came and they said that they have been getting increased cases of teenagers who are having a hearing loss as well as ear
Could you go
tumor.
through that presentation
And in
for
fact,
us?
Interphone
Could you go through that presentation for us?
Interphone study had come, and that Interphone study reported in June 2010 that there is a 200% to 400% increase in the brain tumor cases for people who use half-hour phone for 8 to 10 years. And in fact, in that they had only included the adults; they had not included children. And it is a known fact that children's skull is actually weaker. So for example, for an adult, the penetration would be 25%, for 10 years it is 50%, for 5 years it is 75%. So children are much more prone to the problem than the adults.
Alright.
And we have seen a lot of people having problem. I did talk to some teenagers also who had this health problem. In fact, I did talk to them that would you like to come on TV? In fact, he said yes, uncle, my friends also have this ear tumor problem. So I said, would you come on TV? But I tell you, none of their parents allowed them to come on the TV. They didn't want their children, that people should know that their children are having a hearing problem.
If I could ask
Of course, tomorrow who will marry them?
Alright, that's certainly one of the added risks. But Dr. Girish Kumar, if I could ask you, we have an oncologist here who is not as convinced about that link yet. You as an electric engineer though have been at the forefront of asking that cellular phone towers reduce their amount of radiation. You've even developed some kind of a device that decides how much radiation goes out of a cell phone. For example, I have a Nokia phone over here. Is there some way you have a gauging just how much radiation is going out to it?
Yes, we actually have developed some demonstration things. We are actually just to show people what this radiation can do and what are the things happening. I'm just going to make a call and you will actually just see, this is the one device. When I make a call, can you see that LED is blinking? Maybe it's not very clear. Yeah, you can see that LED is blinking.
Yes.
Now this LED is blinking without any battery. In fact, I'll make another call and show to this monitor here.
Right. Go ahead.
So if you look at the monitor value right now, you can see that the value, one can see that the level is much less. If I make a call,
Right.
you will see that the radiation level is shooting, right?
Yeah, right. So it's pretty much proof that yes, radiation levels increases, but we'll discuss what this really means. We'll take a very short break. When we come back, how you can protect yourself if you're worried about it, and just really what this radiation means with Dr. Samir Kaul and Dr. Girish. Could emerge from the use of cell phone. We're discussing the WHO report that says mobile phones can cause cancer.
Well, the good news is there is lots you can do to reduce the risk if there is any. Amrita Tripathi tells you how.
I know it's asking you to stop using cell phones altogether because of course that's extremely impractical in this day and age. But here's a quick look at what we can do to limit our exposure to radiation. First things first, try and limit the use of cell phones themselves. Make fewer calls of shorter duration, however feasible that is. Also limit the use of the Bluetooth wireless earpieces. So using Bluetooth will expose you to less radiation than if you're just on the handset Don't use it continuously, and if you have to, switch it from ear to ear. There are more tips coming in as well. Use hands-free as much as possible, because again, you're getting that physical distance from the handset and will decrease the radiation exposure. Keep your cell phone away from your body to reduce the amount of radiation you are absorbing. Use your phone on speakerphone as much as you can. Again, keeping the phone physically away from your body so that you're not exposed to that much radiation. Use text messaging or email, experts suggest, instead of necessarily talking, as far as you can get away with that. Avoid using your phone in elevators, in buildings, when you're driving, essentially when the signal is cutting in and out, because the weaker the signal, the more work your phone is having to do. The weaker the signal, the more radiation you are being exposed to. And this is also something that pediatricians have been telling us: limit the use of cell phones by children. Remember, their brains are not entirely formed, and not enough studies have been done on how they're impacted. Most cell phone safety manuals, in fact, do tell consumers not to keep their cell phones next to their head. They say 5/8 of an inch or so away from your head, not even in your pocket. So what all of this means essentially is that we're going to have to modify our phone usage. Use your hands-free. That's probably the most convenient thing that we can advise you to do at this point. Though there's some amount of radiation coming from the wire, it's still significantly less.
I didn't know we had to think so much before using a mobile phone, but Dr. Kaul, is this just a reasonable trade-off? As an oncologist, would you say it's a reasonable trade-off for the lifestyle that we live in modern day?
Well, I'm not going to say the last word on it, but yes, in the modern times, the food you eat, the coloring agents in your tie, the lifestyle that you adopt, the pickling agents, the preservatives, the air, the carbon, the soot all around you, all causes more cancer. There's no doubt about it.
In fact, the IRC lists all kinds of carcinogens. I have a list which says pickled vegetables, fuel oil, gasoline, coffee, diesel fume. All of these increase the risk of some cancer or another. In a sense, are you saying that the risk from cellular phones as of now is about the same as those?
Probably what you're saying is correct. What you're saying is that this is something that you're going to have to take as you go along, pretty much like you take the hamburgers that you eat and everything else.
And of course, if using a cell phone increases the risk of cancer, having to text all the time might increase arthritis at some point.
Well, I mean, like you knew earlier on that vitamin D was always good for you, but now you know it isn't always good. It causes hypovitaminosis D.
Right.
So the same thing could happen 10 years hence. But I'm not being jingoistic right now.
Science changes, and so do your cell phone models constantly. So, well, thanks very much, Dr. Kaul, for putting in a more calming view on cell phones, and also Dr. Girish from IIT Powai for explaining how radiation actually works.
It certainly can't hurt to use your cell phone less. Even so, that's all we have time for here on 8 p.m. Prime.